So last year we only had 337 organ donors in Australia. So that's for every single major hospital in Australia. We only captured that many people, which led to 1,000 transplants. In Queensland we had 67 organ donors for the whole of Queensland, when you think that there's 2,000 people waiting. And we had 18 organ donors last year on the Gold Coast, so we did all right on the Gold Coast. We have a very high consent rate. So we get about 85% consent rate from families in the intensive care. Other hospitals or other states get lower, only about 50% of families say yes when it comes to the crunch. You can see we had a lot more tissue donors in Queensland, and that is because most people can donate tissue on death, and that is retrieved from the mortuary. So 45,000 people died in Australia last year, but only 730 died in the way you can donate organs, because you have to die a special way, you have to die of brain death. But we only got 390 consents, so we're sitting about 54% consent rate. And when you become brain dead, you become very unstable, so the things can happen in the intensive care and we might not get you to theatre. It takes about 15 hours from asking a family to the time we actually go to theatre. So in that time we lose some donors. So actually only got 337 donors out of the 390 consents, which led to 1,000 transplants. So that's fantastic, because that's our highest transplant numbers so far to date. And when you meet recipients, they are so grateful to their donor family. And recently a young boy in Sydney, who's Will Chapman, you can YouTube him. He was waiting for a heart-lung from a congenital heart disorder, and he would only have had till Christmas to live, and he just got transplanted last week. So that was a really good relief. I put a thank you out already, and it's fantastic news. So tissue is your eye tissue, the covering of your eye, the cornea, the front, not cataracts, not inside. So if you've had cataract surgery, you can still donate corneas up to 90 years of age with cancer. So it's amazing for families that still want to donate. Heart valve tissue, bone. Bone is the most used tissue. Our orthopaedic surgeons use it every day in our theatres. So someone having their leg amputated, say from a bone cancer, they can cut that cancer out, pack it with donated bone, and it will form a solid bone again. And we've got skin, so the Bali, and that was just recently, the Bali bombing. We had to import skin into Australia from America to cover all the burns victims. So skin is crucial as well. So most people can donate tissue, and that's fantastic, but organ donation, you have to be on a ventilator in intensive care getting oxygen to your organs, because they can't transplant successfully once you're deceased. So that's heart, lungs, liver, kidneys, and we've got 2 kidneys. You can split a liver and you can split lungs as well. And you will hear about dads or mums donating kidneys to family members or their sons or daughters, and that's fantastic. But that doesn't happen a lot still in Australia, so many people are still waiting for kidney donations. 1,400 is on the waiting list at the moment, still waiting for a deceased donor. Most of us here, this is why it's so hard to capture, brain death, is most of us will die a cardiac death, and you cannot donate organs with a cardiac death. But brain death is only 1% of us will die of brain death. It's a really rare way to die in an intensive care, and most people wouldn't know that about organ donation. They all sign the register or put it on their licence, but it doesn't really matter, but you have to end up dying of brain death to donate organs. And we have to define it in legislation, because we have to practice under some legislation, and we do practice under the Transplantation Anatomy Act of 1979 for Queensland, and that irreversible cessation of all circulation of blood in the body of a person is cardiac death, and all irreversible cessation of all function of the brain is brain death. Cardiac death is easy to understand. Your heart stops beating, and you stop breathing, and your brain dies. And most of us will die that way eventually, and that is a normal way to die. But brain death is, you have that insult, whether you have a massive bleed or whether you hit the steering wheel of your car and your brain swells up. Just like if you're playing football or netball and you twist your ankle, it swells immediately, so does your brain. But it's got nowhere to go, and it's encapsulated by your skull. So it just swells up inside. And brain controls your breathing, so your breathing stops, and then your heart will stop beating because it doesn't receive oxygen because you're not breathing. But if you're scooped up by the ambulance here, and they take you to the emergency department and they put you on a ventilator, your brain will continue to swell and you'll just look asleep on the bed and pink and warm, but your heart won't stop beating because it's receiving oxygen from the ventilator. So then we have to do testing to show the family that the brain has died, which takes a couple of days. It's not like they come into the ED and we go, okay, they're going to be an organ donor. It doesn't happen. We do a lot of testing and we work really hard with our families to help them understand that this person will never wake up again. And I've seen all these causes. I've seen young kids fall off skateboards backwards out of trees. I've seen accidents. But the biggest cause of donors in the intensive care at the moment all through the world is older age donors, and it's bleeds in the head. And that is actually on the rise throughout the whole world, where younger donors are coming down because we don't have the accidents as much. We have airbags, we have speeding rules, etc. Now my job is to work really hard with the families. I support them in any way I can, and when we show them the testing, we like to show them the scans as well, because that helps them understand that there is no function in that brain anymore. So this is a normal perfusion scan of a brain, which should all look like this. And you can see that on that slide there's no perfusion. It's just all so swollen and tight, that brain, no flow can flow into it. And that is brain death. That is the whole brain. It's not brain damage where you might wake up or be able to breathe by yourself. When you're brain dead, you can't breathe. You are clinically dead, and once we show that scan, once the second doctor views that scan, then we can write out a death certificate in the intensive care because they are legally dead. And then the police come and ID the body. There's a few myths out there in the community that worry people, and this is one of them. They think that if you have a donor card and you come into the emergency department, we're not going to try and save your life. And my girlfriend bailed me up about this. She goes, oh, my dad told me never carry your donor card. Like, you know, if you come into emergency, they will just go, oh, they want to be a donor. I can assure everyone that doesn't happen in Australia. We do everything to save you, and it'll only be 2 or 3 days later, or maybe a day or two later, in the intensive care where the medical staff will talk to the family that there's no more that we can offer that family, and then they will go down different pathways then. There's no disfigurement in organ donation. People worry that they're going to be, I don't know, mutilated or cut up. It's not what happens. It's a very respectful surgery in the operating theatre. It is a long incision, but it is sutured back up and it's covered with the dressing, and there's no disfigurement, there's no bruising. Even the eye bank reconstruct the eyes, so the eyes can be closed and people can have an open casket at their funeral. So they look exactly the same. So for people that worry about that, even retrieving bone or skin, there's no disfigurement. Everything is sutured back up and respectfully covered with the dressing, and we wash the patient and put a gown on. The family can have a viewing. So it's very respectful. It doesn't cost families anything, even in a private hospital. The federal government take all the costs when the family wanted to donate. And I've had quite a few donations happen here in the private hospitals here in the Gold Coast. There's no delay in funeral arrangements, but we do have a lot of coroner's cases, because if you fall down some steps at a nightclub or if you're king hit in a school, you'll end up in the coroner's pathway. So we do tell families, if it is a coroner's, that I always talk to the coroner and the forensic pathologist anyway, but that the body will be released when the coroner is ready to release the body, and unfortunately we can't do anything about that. Otherwise it's a normal process with the funeral directors. The biggest thing here is that family can overturn the wishes. So you can have it tattooed on your head or whatever you want, but if your family, not that you'd want to do that, but your family can say no. So it's very, very important that people think about asking their family their wishes, because I know that when I've asked families in the intensive care, the families that know the wishes of their loved one have never had to struggle with the decision. But I know that families that don't know the wishes really struggle, because they try to make a decision. They're already struggling with grief because they've